This topic is acute rheumatic fever. Rheumatic fever is an immune-mediated complication of an untreated strep infection, specifically Group A streptococcus, or GAS infection. This causes a generalized inflammatory response throughout the body, and this causes gross inflammation of the cardiovascular system, musculoskeletal system, central nervous system, as well as the skin. As you can see in our illustration to the right, the client will start with a strep infection, let's say strep throat, since that's a common infection we all know well. Once the client has that active infection, the immune system will be activated to fight the bacterial infection. B and T cells are primary immune response cells. So when the GAS bacteria are presented to these immune response cells, the immune system will start to create antibodies. The issue in rheumatic fever is whenever the GAS bacteria and the immune response cells interact, this actually creates a cross-reactive response, and the body accidentally or mistakenly attacks healthy tissue instead of targeting the bacterial infection. This will then lead to that gross inflammation of those organ systems we discussed. If this is left untreated, this can actually lead to permanent valvular heart disease. It's important to highlight that clients who have the original streptococcal infection will see resolved symptoms within 3 to 7 days. But if this original infection is left untreated, the client will then experience symptoms of rheumatic fever about 2 to 6 weeks after that original infection. When it comes to clinical features of rheumatic fever, we need to think of the major clinical features and the minor clinical features. When you're thinking of the major symptoms, think Jones. This includes joint pain or migrating arthritis. This just means that multiple joints will be involved and there's pain due to that inflammation within that musculoskeletal system. Carditis, we'll see inflammation of the heart, and we can see this in different facets, such as inflammation of the lining of the heart, known as pericarditis, inflammation of the heart muscle itself, known as myocarditis, or even endocarditis, which is inflammation of the lining of the inside of the heart. Nodules will appear, and these will be subcutaneous or deep under the skin, so these are a lot easier felt rather than seen. Erythema marginatum, which is a rash that presents on the trunk and the limbs. Sydenham chorea. These are jerky, involuntary movements of the limbs, trunk, and even the face. These movements mimic twitching. When it comes to minor features of rheumatic fever, think of FRAP. The client will experience fever, raised ESR or CRP. Now these two are blood levels that are inflammatory markers. So of course they're going to be elevated when we have an increase in inflammation within the body. Arthralgia, or those joint pains due to that inflammation within the joints. And prolonged PR interval. Remember, there's inflammation within the heart, so this will reflect in EKG changes. Rheumatic fever is diagnosed via an elevated or rising ASO titer, also known as anti-streptolysin O. This is a blood test that measures the antibodies against anti-streptolysin O, which is a product produced by the Group A strep bacteria. As you can see, this image is an example of the rash clients may develop with rheumatic fever, known as erythema marginatum. You can see that this is a round rash that has a pale pink color in the center and is surrounded by raised erythematous borders. Remember, this originally starts on the trunk and the limbs. Now let's watch an animation to show what exactly chorea looks like.
Chorea is a hyperkinetic movement disorder characterized by involuntary movements which are irregular, random, and brief. These movements usually affect the distal limbs. The movement has no pattern in the direction, timing, or speed, but they flow from one body part to another, giving the impression of dancing. Chorea can be caused by hereditary conditions such as Huntington disease, or acquired conditions such as stroke or Sydenham chorea.
Our first priority is to treat the bacterial infection, as it is with any type of bacterial infection. So remember, strep is a bacteria, so our first-line treatment is going to be penicillin. We also need to encourage supportive cares. So if the client is experiencing arthritis, we need to encourage them to rest or even perform passive range of motion exercises in bed to decrease the impact and even pain. Anti-inflammatory agents can help to decrease that inflammation that's causing this pain. and even alternate heat and ice on the joints. Applying heat can help loosen up the joint and increase mobility, and ice will help decrease the inflammation. If the client is experiencing chorea, we need to make sure that safety is our #1 priority. So this means assisting them in grabbing certain objects or even performing daily activities. Of course, we want to prevent falls, and that's going to be our #1 priority. When it comes to rheumatic fever, we need to make sure that we're appropriately educating our clients on what the treatment plan looks like. There will be long-term prophylactic treatment of penicillin therapy. These clients will take monthly doses of this penicillin, and they need to make sure that they're sticking to this, especially if they have any upcoming dental work or invasive procedures. Because of the generalized inflammation, the client is at higher risk of complications of any further or secondary infection. Compliance with this prolonged penicillin therapy is so important. We really want to make sure that because they're at higher risk of secondary infection, we can prevent that from happening. Routine cardiology appointments are important to monitor the amount of inflammation in the heart and even to check for any new murmurs. This also includes possible EKG changes that the cardiologist or their healthcare provider needs to stay on top of and monitor. Encouraging clients to resume physical activity once their symptoms subside or resolve is very important. We need to make sure that they're staying active and healthy. It is important to let clients know that they most likely won't be able to get back to this physical activity right after having a diagnosis of rheumatic fever, as they will experience these symptoms for a more prolonged period of time. It's not just like a regular strep infection or a cold. It's going to last a little bit longer than just a typical week. It's so important that clients with rheumatic fever report streptococcal infections in the future. Because clients have already experienced and had rheumatic fever, they are at an increased risk of developing it again. Yes, they can get this again. This includes any type of strep infection, including skin infections such as impetigo, strep throat, or even scarlet fever. Clients with rheumatic fever need to be very careful not to get sick. This includes decreasing their exposure to anyone who is currently ill. Let's discuss the complication of rheumatic fever, known as rheumatic heart disease. Now, if you trace back to the first slide, you can remember that we discussed that clients that don't get treated for rheumatic fever can actually have permanent valve damage within the heart. This most commonly occurs in the mitral valve. This is due to prolonged inflammation that leads to scarring and even stenosis or hardening of that valve. Once this occurs, the valve is no longer functional and will actually cause regurgitation of blood back up into the atria. If this becomes very serious or severe, the client may actually need to undergo a valve replacement.